Wilms tumor, also called nephroblastoma, is a type of kidney cancer that primarily affects children. It is the most common type of kidney cancer in children and typically occurs in children aged 3 to 4 years but can develop up to age 7. Wilms tumor is rare in older children and adults. Causes and risk factors. The exact cause of Wilms tumor is not well understood, but it involves the growth of abnormal cells in one or both kidneys. These cells may be a result of genetic mutations or developmental abnormalities that occur before birth. Risk factors for Wilms tumor include genetic factors. Some children with genetic conditions are at higher risk, including those with Beckwith-Wiedemann syndrome, a condition associated with abnormal growth patterns, WAGR syndrome, which includes Wilms tumor, anorexia, genitourinary abnormalities, and intellectual disability, Dennis-Drosh syndrome, which causes kidney problems and developmental issues, Salter syndrome, a rare genetic condition with similar characteristics to WAGR syndrome. Family history. Children with a family history of Wilms tumor may be at a slightly increased risk, though most cases occur in children with no family history of the disease. Ethnicity. Wilms tumor is more common in African American children than in children of other ethnic groups, particularly in younger children. Age and gender. It is more common in children under 5 years old, with a slight predominance in girls. Congenital abnormalities. Children with certain birth defects, especially involving the urinary tract, may have a higher risk of developing Wilms tumor. Symptoms of Wilms tumor. The symptoms of Wilms tumor can vary, but common signs include abdominal swelling or mass. A noticeable lump or swelling in the abdomen is the most common symptom. It is often painless but can be noticed by a parent or during a routine checkup. Abdominal pain. Some children may experience pain in the abdomen, particularly if the tumor grows large. Blood in the urine, hematuria. This can occur if the tumor affects the kidneys. High blood pressure, hypertension. A tumor growing in the kidney can sometimes affect kidney function, leading to high blood pressure. Fever. A child may develop a fever, although it is not always present. Loss of appetite or weight loss. Children may appear to lose weight or have difficulty eating due to abdominal discomfort. Fatigue. Feeling unusually tired or lethargic is common with Wilms tumor. Other symptoms. Less commonly, the child may experience nausea, vomiting, or constipation, depending on the tumor's location or size. Diagnosis of Wilms tumor. If Wilms tumor is suspected, the following tests and procedures may be used to confirm the diagnosis. Physical examination. The doctor may feel for an abdominal mass or signs of other symptoms. Ultrasound. This is often the first imaging test used to detect a mass in the kidney. It can also help determine if the tumor is solid or cystic. CT scan or MRI. The computed tomography, CT scan or magnetic resonance imaging MRI, may be used to get more detailed images of the kidneys and surrounding organs, helping to assess the extent of the tumor. Biopsy. A biopsy may be done to confirm the diagnosis and type of tumor, though it is not always necessary in cases where imaging results are clear. Urinalysis. This may be done to check for the presence of blood in the urine, a possible sign of Wilms tumor. Blood tests. Blood tests may be used to check kidney function or identify any related health problems, such as high blood pressure. Chest X-ray, to check for any signs of the tumor spreading to the lungs. Staging and prognosis. Once Wilms tumor is diagnosed, doctors will assess the stage of the disease to determine the best treatment approach. The stage refers to how far the cancer has spread. Stage I. The tumor is confined to the kidney and can be completely removed by surgery. Stage II. The tumor has grown outside the kidney but can still be completely removed. Stage II. The tumor has spread to nearby lymph nodes or other parts of the abdomen, but can still be treated. Stage IV. The cancer has spread to distant parts of the body, such as the lungs, liver, or bones. Stage B. Both kidneys are affected by the tumor. The prognosis for children with Wilms tumor is generally good, especially if diagnosed early. The survival rate for Wilms tumor in children is quite high, with around 90% of children diagnosed with localized disease stage I or II surviving the cancer. Treatment of Wilms tumor. Treatment for Wilms tumor usually involves a combination of surgery, chemotherapy, and sometimes radiation therapy. Surgery. The main treatment for Wilms tumor is surgical removal of the tumor. The surgeon will usually remove the affected kidney nephrectomy. If the tumor is very large or involves surrounding structures, part of the kidney or surrounding tissue may also be removed. In some cases, if both kidneys are affected, the partial nephrectomy removal of only part of the kidney may be possible to preserve kidney function. Chemotherapy. Chemotherapy is often used after surgery to kill any remaining cancer cells and reduce the risk of recurrence. The specific chemotherapy regimen depends on the stage of the tumor and whether the cancer has spread. Drugs like vincristine, bactinomycin D, and doxorubicin are commonly used in the treatment of Wilms tumor. Radiation therapy. Radiation may be used if the cancer has spread to nearby lymph nodes or other areas. Radiation is more commonly used in cases of advanced disease stage II or IV or if the tumor has not been completely removed by surgery. However, radiation therapy is typically avoided in young children due to the long-term risks associated with radiation exposure, such as the potential for future cancers or developmental issues. Kidney transplantation. In rare cases where both kidneys are severely affected, the kidney transplant may be considered after the tumor is removed and the child has recovered from treatment. Follow-up care. After treatment, children will need regular follow-up appointments to monitor for any recurrence of the tumor or long-term effects of treatment. Follow-up typically involves imaging tests, blood pressure monitoring, and evaluation of kidney function. Long-term outlook. The long-term outlook for children with Wilms tumor has significantly improved due to advancements in early detection and treatment. The survival rate for children diagnosed with localized Wilms tumor is greater than 90%. However, children who require aggressive treatments, e.g., chemotherapy or radiation, may have a slightly higher risk of developing long-term health issues, such as kidney problems, secondary cancers, or developmental concerns. Conclusion. Wilms tumor is a rare but highly treatable kidney cancer that primarily affects young children. Early diagnosis and treatment have led to very high survival rates. Surgery, chemotherapy, and sometimes radiation therapy form the core of treatment. While the prognosis is excellent for most children, long-term follow-up is important to monitor for any recurrence or late effects of treatment.